Hi, I'm Jonathan Baillie, editor of Health Estate Journal, the HEJ magazine, and I'm here on the afternoon of the second day of Healthcare Estates 2024 with David Hartley, who's Managing Director of Modern Methods of Construction Specialist, MTX, and to find out a little bit more about the company, some of its current activity, and some of the recent highlights for the business. David, can you start by just telling me a little bit about how MTX was formed and the background to the company?
Yeah, so we were formed in 2002 by myself and my father, both with a history of expertise and knowledge in the healthcare sector. Initially, we were focusing on operating theatres, refurbishing, remodelling. We received quite a number of inquiries often for modular healthcare buildings, and at the time we didn't have a solution. So it was a very, very easy decision to respond to the market, to be able to offer a solution for that. And as I say, our first operating theatre was in Aberdeen, followed by a project in Aberystwyth, Leicester, and then the rest is history. And since then we've probably built over 150 buildings nationally, up to 300 operating theatres. My brother joined the business a couple of years after its conception.
What's his name?
His name's Stephen. He's actually he's one of our board directors. He's a project director, oversees multiple projects, very, very hands-on. He's got a real expertise when it comes to construction. He's just one of probably 100 strong team that we have now, working from our headquarters in Wilmslow, South Manchester.
And how is the business involved in terms of moving to sort of more modern methods of construction? Has that really been in line with market expectations, what the healthcare market has wanted in the UK?
Yeah, absolutely. I mean, it's a very good question, a very good point. We've seen, particularly in the last 4 or 5 years, a huge growth, a huge demand in terms of our facilities, our services, and I think a lot of that has been led by the government's construction playbook. There is a directive that government departments adopt modern methods of construction, and we're seeing that demand. I think particularly hospitals, minimising disruption is key. The fact that we're able to construct both substructure, superstructure in parallel, the superstructure being constructed away from site ensures that patient pathways are maintained, disruptions minimised. Obviously we've got the opportunity to reduce waste, it's a greener solution, improve quality control, and we're not just involved in the volumetric building, we're bringing in multiple categories in terms of the MMC elements, such as pre-manufactured building services, offsite foundation solutions, cladding solutions, lift shafts. There's a whole list of components that we bring together to create a solution that maximises the off-site element, increasing pre-manufactured value.
And I think pre-construction services is another area that you're very much involved in, am I right there?
Yeah, absolutely. So what we want to do, what we do is we're providing a complete solution from cradle to grave. Historically, I suppose we've just been involved in the construction element, but I think particularly trusts, I think they like and adopt the approach where they can work with a construction partner to give that, as I say, cradle to grave solution. We work with them at pre-construction stage to identify the design, the requirement, the programme, supporting costing, supporting outline business case, full business case, and at which point we're then able to go into construction. But the advantages to it is that as opposed to traditionally when clients are working with a design team that's not affiliated necessarily with the construction team. There is a divide, whereas what we're doing is that we're bringing it together. So when we go into construction, we know exactly what we're building.
So what would have been some of the drawbacks have been of the more traditional approach with, say, a trust working with a design team and then with a different main contractor?
Yeah,
What are the sort of deficiencies of that?
Yeah, it's the inefficiencies really, because the design team would design a building in terms of the layout of the building, for example, the MEP services, but not necessarily engage with the contractors. So they would specify and identify in drawings and specifications what they required, but then of course when the contractor comes on board, it's not necessarily buildable in the sense that was initially perceived.
Envisaged.
Correct, yes. So as I say, when we've got that joined up approach from pre-construction to construction, there is a clear, there is confidence and clarity in terms of what we're doing all the way through the process.
And presumably one of the major benefits, I know it's not the only one, you've talked about others of MMC, is the speed of which you can get buildings completed, which in the NHS is often absolutely critical, particularly in response to sort of things like I'm trying to get waiting lists down, etc.
Yeah, absolutely. And our buildings, I mean, we deliver our buildings from construction, from a construction point of view. In fact, rewind. The minute our clients are aware that this is an MMC solution, for me there's a change of mindset, and that's the whole team. That's the client estate capital driven team, the user groups, the consultants, the contractors. There's a change of mindset that pushes the whole programme, because they're aware that it needs to go quickly. So I think there is an increase in speed and efficiency there. But in terms of our programmes, we're 60% quicker than a traditional solution. And then, as I referred to before, there is lots of benefits in terms of the reduced disruption that you get. And of course, because of that speed, our clients benefit from the faster return on investment, offering the opportunity to be able to care for patients much sooner.
Is there a greater element of sort of risk sharing with the way you work with your NHS clients?
I think they're quite the opposite, really. And we are, because of we're so connected to the pre-construction, the construction process. I would say that our ability and our confidence in the delivery of the project is far greater than it would be traditionally, and as a result, less risky. So yeah, I mean, we are very, very much, once we get the nod on construction, we're very, very much let's go. And in terms of our risk register, very limited.
I think in recent times there's been a particular focus from the government and the Department of Health and Social Care on surgical hubs, and I believe that one of your biggest contracts to date, or certainly a very large one, is the construction of I think it's an 8-theatre hub at Colchester Hospital. Can you tell me a little bit about that project?
Yeah, I mean, I'm incredibly proud of what we're achieving there. It's actually coming to a close within the coming weeks. An absolutely fabulous facility, incorporates 8 operating theatres. I think there's 74 beds. It really is a state-of-the-art facility, and once complete, I believe it's going to be one of the biggest elective hubs in the country, if not Europe. There is a particularly large basement that houses all the mechanical plant. There is a further 3 floors. All the operating theatres are on the ground floor, and the upper floors are bed space. But you know, I would challenge anybody, if there is any hint that modular build or MMC comes with its compromises, is very, very far from the truth, and quite the opposite, given the advantages I refer to. So any construction expert who would want to visit the facility, I'd welcome, because we've got concrete floors, we've got traditional MEP systems. They're the same MEP systems that you would find in any traditionally built building, albeit that a lot of what we do is, again, done off-site, pre-manufactured skids, pre-manufactured pipe work. As I say, all very, very compliant, but it really is a fabulous facility and something that we're incredibly proud of.
How did you win that job? Is that through an existing relationship with the trust involved?
Yes and no. We've done some work at Colchester several years ago, smaller project, but I think there was a push, particularly on the East Coast, to do some work. We've previously done a project at Norfolk and Norwich, and it really is relationships with the project teams that we've worked with previously that gave us that opportunity. And again, we work from pre-construction through quite a fast, streamlined pre-construction period to understand what that requirement is, understand what that building looks like, and again, supporting our client with cost advice, programme advice, and giving them the confidence that we can go into construction. Of course, they then go through the formalities of gaining approval from NHS England, which was obviously successful. But yeah, it's a really, really good project.
And is it right that you won a further surgical hub project recently at Oxford John Radcliffe?
It is, yes, and again, we've been working on, I think we're at stage 2 of the design process, but we're actually on site now, so yes, again, another fabulous facility. There's some amendments to the standard layouts, given a new concept that the NHS will be supporting. It just changes the arrangement in terms of the anaesthetic, but again, that will be a state-of-the-art facility, and it really is a pleasure to be working with an existing client on.
So what else have you built for that trust recently?
We built, I think it was completed probably 2 years ago now, a large ICU building for them. I think it's a 4-storey building. Which
in fact we covered in HEJ.
Correct.
And I visited. It was
Correct,
extremely impressive.
Yeah, absolutely. And actually the new building's located adjacent to that.
Yeah. So your expertise really spans a very wide range of healthcare buildings, you know, wards, clinical areas, operating theatres, mortuaries. You've done a real range, haven't you, over the years?
Yeah, we have. I mean, particularly in recent years. I mean, as I said at the beginning, we started out, it was a lot of operating theatres. I think given the changes in the way that our clients, the NHS, treats patients, it's evolved over 2 decades, changes in science, change in patient demographics, the list goes on. So yes, with lots of wards, endoscopies, CDC of course is a relatively new concept. You're right, mortuaries. Anything that's technical where we can add value, that's really is our sweet spot. Whilst we've constructed offices and general buildings in the past for the NHS, we don't necessarily add a huge amount of value, but when it comes to something technical and challenging, that's where we can offer the full benefits of what we do.
Presumably over the years, to evolve and adapt and be able to tackle these different projects, you've invested in staff considerably over time as well. The business has grown people-wise, I believe.
It has, yeah, and again, upward of 100 people working for us directly. We've got a clear commitment to support our apprenticeships. We're forever excited about bringing school leavers, graduates through the business to be able to educate them work with them to support them on their own journey, but as well that supports the business in terms of its sustained growth. So there'll always be a commitment for that, and even myself, I followed that same process quite a long time ago now.
How easy do you find it to reach young people who are interested in construction, and how do you do that?
Very difficult. I won't get on the soapbox, but I think things have changed a lot. I think there is an ambition for young children, young adults to go through formal education, and I don't think the apprenticeships, the courses aren't as necessarily readily available as they were, which I suppose is slightly disappointing. But of course, there's the more formal routes, and they're available and they're there, but it's not as easy as I would hope. And given also, it's recognised by the government, and I think that's part of the reason, I know that is part of the reason for the MMC drive. We've not got the labour available in this country, given the lack of apprenticeships and the dot-com bubbles and the move away from construction. We've not got the labour available in the country to build things the way we did traditionally. And as I say, that's the whole reason there is a huge drive in terms of the government's MMC initiative to drive that construction element in factories where workforces are local. That's obviously the reason that they're doing it.
And that's use of a lot of offsite has obviously been one of your key successes. I know you're not alone in doing that, but that's been a big factor in quality control as much as speed.
Yeah.
And continuity of hospital activity with less disruption than a traditional build.
No, absolutely. And again, we're in a world where, particularly post-COVID, where I suppose people are less mobile than they were. I remember spending lots of time up and down motorways, and it's all done by Teams now, and Zoom is it. But I think that the point being is that I think people are quite happy to be in their own region, and they don't necessarily want to be travelling up and down the country. But the way we construct our buildings means that we can work with local factories, with local employment, serving those factories. And then, yes, there is an element of the work that has to be done in situ, but that really is the completion, as opposed to, from the conception upwards and all the disruption and travel that may go with that if that was traditionally.
What have been the sort of challenges for the business sort of in recent years? Where have things been, you really had to think sort of outside the box, if you'll excuse the expression, no pun intended?
Yeah, obviously, and it's not just us, but it's the whole world. We had to adapt when it came to COVID. It was particularly challenging to receive
materials supply, presumably.
Yeah, it was during that when we all went into lockdown. It's distant memory, hopefully, and thankfully. But when we all went into lockdown, it was very, very frightening to learn that information. And of course, we've got multiple at that very time, upwards of 10 live projects with a team of people that really wanted to go to work, and to be told that we couldn't was a challenge. That quickly changed within 24 hours when we received a formal letter from each chief executive saying we must continue. That took a little time to go
orchestrate.
Yes, correct, and then trickle its way through the supply chain, such as builders, merchants and the like. But we were all key workers, as were our some of our main supply chain. So continuity was key. It was a very, very challenging time, but here we are. I think in conjunction with that, though, you ask what challenges are. You touched on it in terms of labour. Particularly, I say labour, bringing professionals to the business. That will always be a challenge. We've got a great team, incredibly proud of the team, what we achieve, and our culture. Maintaining that, though, and finding the right people is one of my biggest challenges.
I can imagine that. Well, business success is about the calibre of the people you employ. Finally, how has healthcare estates been for you so far this year?
Really, really good. I would say I've been attending. We go back to the early days where I was in Harrogate, and
Me too.
Yes, a very, very different arena to the one that we're in here. But yes, I mean, we touched on COVID. It was obviously disappointing that it didn't quite happen, or it didn't happen. But yeah, prior to that, there was a real buzz. But I have to say, to the past 2 days, there's a real buzz and excitement about the place. And in terms of how busy it is, it's something I've not experienced for a number of years. Some really professional stands. We're obviously in Manchester, a great city, great hub in the centre of the country, allows people to connect. It's been really good, and of course the fringe events have been quite exciting too.
Good. Well, I'm glad you've enjoyed the show, and thank you for talking to me, David. It's always interesting to chat to you. I know MTX has a great pedigree, and I wish you all further success for the future.
Yeah, no, thank you very much, Jonathan. Nice
Thanks.
to see you.
Cheers.